Thank you for joining us for the final presentation of Alexapath. Today we'll be talking about mobile whole slide imaging, or MWSI. This is a system we've created to expand access to telepathology through microscope accessories. Our target market for this presentation is India and cervical cancer. First, let me tell you about us. It all started in 2010 when I was deployed as a relief worker for USAID in Haiti. While at one of the hospitals, a woman came in showing outward signs of cancer. She asked the doctors to give her a diagnosis, and while we had a surgeon on staff who was able to perform a biopsy, there was no specialist or pathologist available to view that biopsy. The only choice we had was to give her her specimen in a small jar of formalin with instructions to get to the nearest lab, which was 7 hours away by car. She never did this, and consequently, the next time we saw her, her symptoms were much worse. Our goal is to provide diagnosis for anyone, anywhere in the world who needs it. To do that, we've put together a team that is up to the task. I'm CEO and co-founder Lou August. On my team are my fellow founders, Deval Palsana and Shashir Malev, both engineers from NYU. We are also joined by Michael Cook, who's an MBA, and Diana Brooks, who works in marketing and business development. We are also supported by a team of clinical collaborators, including Dr. Michael Esposito, Dr. Tafik Bouya, Dr. Fatima Jalul, and Dr. Kristen Jacobs. All four of these pathologists have given their time for free over the last 3 years to help make this project a reality. We founded our company in February 2015. Just 3 months later, our prototype won the ASME Award for Best Hardware Innovation. We published our methods in the British Medical Journal a month later. 2016 has been a busy year so far. We finished our first preclinical validation study, which had a 95% concordance rate between glass slides and digital slides created through the MWSI process. Then we received approval to do a full clinical validation trial, which will be starting later this year. We've also secured funding from the USIS TEF, a collaboration between the United States State Department and the Indian government, to launch a field trial in India in January 2017. We are currently looking for additional funding to help reach a few milestones on the road to our anticipated launch in 2017. Over the course of the GSBI program, we've really dug deep into India's cervical cancer problem. We think this is a big market for us because one woman dies every 8 minutes from cervical cancer in India. The length of survival often depends on the stage of cancer at the time of diagnosis. One of the biggest problems we find in India is that rural India has a poor detection rate, with only 10% of cancers being diagnosed in stage 1 or stage 2, which is less than half of that in China, the UK, and the US. Not surprisingly, India also has the highest number of cervical cancer deaths. At 22.8%, it has a higher incidence than all of its global peers. It also has a higher mortality rate, nearly 4 times higher than that of the US. There are a number of key barriers that have led to this problem becoming as bad as it is. The largest barrier is less than 2% of the female population has access to pap smear screenings. 70% of the population does not have insurance. 80% has a monthly income of less than $250. 89% are unaware of the risk factors of cervical cancer. 93% have poor knowledge of the symptoms and where to get screened. Finally, 60% of the oncologists are based in urban centers. And because of all these factors, 98% of the population does not have access to screening programs. If we look on the right, we can see that recent studies have found that 118 million women would be willing to be screened right now if you gave them the opportunity. There are 358 million women without access to screening. We can see that globally, there are 1.1 billion women without access to screening right now. We are not alone in our desire to solve this problem. In fact, recognizing these barriers The Indian government has made combating cervical cancer one of the priorities of their 12th plan. Government spending on healthcare is set to reach 2.5% of gross domestic product by 2017, which is up from an average of 0.9% of the GDP less than 5 years ago. These additional funds are being used to create national rural health missions. These are outreach programs of the Indian government that subsidize the cost of medical procedures for the poor, creating a market for affordable products like our own. Now let's talk about our solution. The MWSI system is composed of 3 elements. First is a smartphone app. This smartphone app allows for the capture and transmission of images from the microscope. To connect the smartphone app to the microscope eyepiece, we've created a universal smartphone optics adapter. Finally, the ADA robotic stage is a mechanical device that we have created that sits on top of a microscope's slide bed. This allows for mechanical control of the slide movement. With this system, our goal is to create a new care model. An Alexapath telepathology system takes care to the patient, regardless of their location. What we see here is a brief overview of how it works. Starting on the right, you have patients. These are women aged 15 to 60, predominantly in rural areas at risk of HPV. These women travel to their local rural clinic, community health center, or NGO. These groups are working to expand cervical cancer screenings. We provide them with the tools to do digital imaging and transport of slides. Alexapath's IT solution is composed of a digital telepathology website, a patient registry, and a cloud storage of MWSI. This information is then transferred to urban hospitals or external specialists around the world who are able to provide a diagnosis and advice on where to seek treatment. This slide demonstrates how our telepathology ecosystem will be set up for the field trial we are going to launch in 2017. We've already partnered with Kidvai Memorial Hospital in Bangalore, one of the nation's premier oncology centers. They will be providing pathologists and diagnosis to patients who are screened by our other partner, Cancer Care India. This is an NGO that has 28 groups operating in 13 states. They will be given ADA stages and instructions on how to image slides. Those PAP tests will be shared via our website, alexapath.com. And we are collaborating with another partner, Indra, who has developed an algorithm that helps provide auto-stratification of slide results. By expanding cervical cancer screening services, we will improve health outcomes in India. Our low-cost equipment allows deployment in multiple centers. Our cloud-based sharing and registry eliminates the need for IT infrastructure. Our website connects locations with a worldwide network of pathologists. And digital slide transport speeds turnaround times for diagnosis and improves communication. When we look at the impact our stages can provide, 200 stages can be deployed in multiple communities. This would allow 480,000 patients to be diagnosed. At the next level, 50,000 stages could cover nearly half the country. And 120 million women would be able to receive screening. At 150,000 stages, we could cover the total addressable market for all of India and provide screening to 358 million women. Finally, let's conclude with our business model and our ask. In the competitive landscape, Alexapath is the most affordable solution on the market right now, with many features that you would find in a $30,000 product. Also, our reliance on mobile technology eliminates the need for IT infrastructure, another feature that isn't provided by any of our competitors. In addition to the hardware, we also offer a subscription service. This subscription service has 3 tiers. Colleagues, which is free to try, where you can host up to 3 slides and have 2 users. A small group, $200 a month. Organization-wide storage up to 100 slides and 4 users. A larger group, $400 a month. Organization-wide storage up to 200 slides and 8 users. When we break down the unit economics, we can see that the cost of goods for our stage is $250. The client cost for purchasing a stage is $1,000. On the server side, it costs us 48 cents to host one slide. Based on our subscription model, the cost to us will range between $17.28 per year to $1,152 per year. On the customer side, we see the cost to them at the low end is $0 a year, and at the high end, it's $4,800 per year. In the end, we can see that our yield is $730.72 for a customer on the free tier, and $4,396 per year for a customer on the highest end tier. Using those numbers, we have calculated a 1-year break-even analysis. If we are able to sell 195 stages in 1 year, we can generate enough revenue to cover both our cost of goods and our operating expenses for that year. Currently, we are seeking $500,000 in seed capital in the form of $250,000 in grants and $215,000 as a convertible note. This will enable Alexapath to hire a sales team, solidify a regulatory pathway, and IP portfolio. It will also help move the company from field trials to launch in our initial market, India. This investment will help us finish development and deploy approximately 200 devices in India, which could help screen 480,000 patients in a single year. Thank you very much for your time.